A very good morning to all of you. Today we are going to do surgery. Surgery is a very important part of NEET PG and the national exit test. From surgery, about 25 questions are going to come, and they are straightforward questions. Some of them are clinical questions, some of them are fact based questions. So let us begin with the first multiple choice question. Most common cause of small intestinal obstruction is A. Intussusception. B. Idiopathic adhesions. C. Tumors. D. Postoperative adhesions. Postoperative adhesions. What do you think the correct answer here is? Please type in the chat box. If you know the answer, please type in the chat box and why the option is correct. The most common cause of small bowel obstruction, that is, small intestinal obstruction, is post surgical adhesions. The most common cause of intestinal obstruction in adult are intestinal adhesions, bands of fibrous tissues in abdominal cavity that can form either after abdominal or pelvic surgery. In children, the most common cause of intestinal obstruction is telescoping of intestines, that is intussusception. Telescoping of intestines, that is intussusception. So if the question had been for children, you will mark it as intussusception. But for adults, it is postoperative adhesions. So the most common cause of intestinal obstruction is postoperative adhesions. So the correct answer here is postoperative adhesions. Cox specular tumor is A. Basal cell carcinoma, B. Squamous cell carcinoma, C. Ulcerated sebaceous cyst. Ulcerated sebaceous cyst, and D. Cylindroma. Cylindroma. Now, Cox specular tumor is a sebaceous cyst linked growth that can resemble squamous cell carcinoma. The proliferating cyst is usually solitary, but it often arises from simple tricholemmal cyst in the hair follicle epithelium. So the correct answer here is C. Ulcerated sebaceous cyst. False about gastric lymphoma is A. Stomach is the most common site. B. Associated with H. pylori infection. C. Total gastrectomy with adjuvant chemotherapy is treatment of choice. 5-year survival rate after treatment is 60%. Now let us know some facts about gastric lymphoma. Stomach is the most common extranodal site of lymphoma. It is of two types, primary gastric lymphoma and secondary gastric lymphoma. Primary gastric lymphoma is the lymphoma of stomach which exhibits no evidence of liver, spleen, mediastinal lymph nodes, or bone marrow involvement at the time of diagnosis. Primary gastric lymphoma is mainly non-Hodgkin's lymphoma of B cell origin. Most of the primary lymphoma, about 60%, arise in the malt. Arise in malt. Malta means mucosa-associated lymphoid tissue. Malt is usually associated with chronic H. pylori infection. So, low-grade malt lymphomas are thought to arise from chronic H. pylori infection. These low-grade lymphoma may later on degenerate to high-grade lymphoma. Immunodeficiency and H. pylori infection are the risk factors for B cell lymphoma. Most common site of involvement, like that of adenocarcinoma, is the gastric antrum. Now coming to secondary gastric lymphoma. Stomach is the most common extranodal site of systemic lymphoma. Almost all of them are non-Hodgkin's lymphoma. Now the treatment. The role of gastric resection is controversial. Recent studies have shown similar disease-free survival rate in patients treated with surgery plus chemotherapy plus radiotherapy, and patients treated with chemotherapy and radiation therapy alone. Most patients with high-grade gastric lymphoma are now treated with chemo radiation alone without gastric surgical resection. For disease limited to stomach and regional nodes, radical subtotal gastrectomy may be performed, especially for bulking tumors with bleeding and/or obstruction. Most common chemotherapy regime used is CHOP plus rituximab. CHOP stands for cyclophosphamide, doxorubicin, vincristine, and prednisolone. Now, subtotal gastrectomy, usually followed by combination chemotherapy, has led to 5-year survival rate of 40 to 60% in patients with localized high-grade lymphoma. So the false statement is total gastrectomy with adjuvant chemotherapy is treatment of choice. So the correct option here is C. Total gastrectomy with adjuvant therapy, chemotherapy is treatment of choice. Which one of the following preservative is used while packing catgut suture? Please type the answer in the chat box. If you know, anybody please. It is isopropyl alcohol. So the correct option here is isopropyl alcohol. 10% isopropyl alcohol is used in a routine packing fluid used for packing catgut sutures. Catgut is available in glass tubes containing isopropyl alcohol and small quantity of water. Catgut is prepared from the of intestine of sheep. Intestine of sheep. So the correct answer here is A. Isopropyl alcohol. Primary hyperparathyroidism, pheochromocytoma, may be associated with which type of thyroid cancer? A. Medullary carcinoma of thyroid. B. Papillary carcinoma of thyroid. C. Anaplastic carcinoma of thyroid. D. Follicular carcinoma of thyroid. Primary hyperparathyroidism, pheochromocytoma, may be associated with which type of thyroid cancer? It is medullary carcinoma of thyroid. The correct option here is A. 95% of individuals with MEN2A develop medullary thyroid carcinoma. 50% develop pheochromocytoma, and 15 to 30% develop hyperparathyroidism. So the correct option here is A. Medullary carcinoma of thyroid. Meconium ileus is associated with Meconium ileus is associated with Meconium ileus is associated with A. Cystic fibrosis, B. Infant of diabetic mother, C. Hypothyroidism, D. None of the above. Meconium ileus is associated with A. Cystic fibrosis. Now, the cystic fibrosis is a very important topic. It can be asked in pediatrics, it can be asked in pathology, it can be asked in surgery, it can be asked in medicine. So, everything about cystic fibrosis must be known. So, infant with cystic fibrosis have characteristic pancreatic enzyme deficiency and abnormal chloride secretion in the intestine that results in production of viscous water poor meconium. Meconium ileus when occurs when this thick, highly viscous meconium becomes impacted in ileum and leads to high-grade intestinal obstruction. So the correct answer here is A. Cystic fibrosis. You can WhatsApp me directly on 948-365-2020 for any doubts or for any motivation type. Any doubts you can WhatsApp me at any time. I will be happy to reply to you. Which of the following nerve is commonly damaged during McBurney's incision? A. Subcostal nerve. B. 10th thoracic nerve. C. 11th thoracic nerve. D. Iliohypogastric nerve. The nerve commonly damaged during McBurney's incision is iliohypogastric nerve. Damage to this nerve results in the development of right inguinal hernia. McBurney's incision is done for appendectomy. In this, oblique incision is made in the right iliac fossa, about 5 cm above and medial to the anterior superior iliac spine at right angle to spino-umbilical line. So McBurney's incision, also called gridiron incision, is commonly done for appendectomy. In this, an oblique incision is made in the right iliac fossa about 5 cm above and medial to anterior superior iliac spine at right angle to the spino-umbilical line. So the correct answer here is D, iliohypogastric nerve. Dysphagia lassoria is due to A. Esophageal diverticulum. B. Aneurysm of aorta. C. Esophageal web. D. Compression by aberrant blood vessels. Dysphagia lassoria is, what is the correct option here? Please type in the chat box. What do you mean by dysphagia lassoria? The correct option here is D. Compression by aberrant blood vessels. Dysphagia lassoria is a disorder of swallowing caused due to vascular anomalies. The vascular anomalies include a right aortic arch, a double aortic arch, a vascular constricting ring formed by PDA or a ligamentum arteriosum or pulmonary artery or aortic arch, an abnormal right subclavian artery, an abnormal innominate artery. So vascular anomalies include a right aortic arch, a double aortic arch, a vascular constricting ring formed by PDA or a ligamentum arteriosum and pulmonary artery or aortic arch, an abnormal right subclavian artery, and an abnormal innominate artery. Diagnosis is made by lipoidal swallow or arteriography. So the correct option is D. Compression by an aberrant blood vessel. Surgery for undescended testis. This undescended test is a very important topic. It can be asked in embryology, anatomy part, or in surgery also. So, at what age the surgery is recommended? 6 months of age, the surgery is recommended. So, the correct option here is 6 months. Dacron vascular graft is a, it is a direct question. Dacron vascular graft is a textile synthetic. B. What is the most common position of appendix? Again, this is a very direct question, most often repeated, and we all know it correctly, but you should practice it, and you should practice it. It is retrocecal. C. Retrocecal is the most common position of appendix. Now, a little bit about the positions of appendix. Retrocecal 74%, subcecal 1.5%, pelvic 21%, post-ileal 0.5%, pre-ileal 1%, retrocecal 74%, subcecal 1.5%, pelvic 21%, post-ileal 0.5%, and pre-ileal or retroileal 1%. So the correct option here is C, retrocecal. Double bubble sign is seen in If you don't read the question carefully, you will mark it as duodenal atresia. But other options also cause double bubble sign, duodenal stenosis and volvulus. So the correct option here is D, all. Double bubble sign. Now other causes of double bubble sign is duodenal web, duodenal atresia, duodenal stenosis, annular pancreas, midgut volvulus. Other causes are choledochal cyst, mesenteric duplication cyst, preduodenal portal vein, retroperitoneal tumor, superior mesenteric artery syndrome. So the correct option here is D, all the above. Curling ulcer is seen in, we all know curling ulcer is seen in which condition? Burns patient. Curling ulcer is seen in burns patient. In patients with head injury, you will see Cushing's ulcer. So curling ulcer are stress ulcers. They are stress ulcers associated with burns and most commonly found in first part of duodenum. Curling ulcer is an acute gastric erosion resulting as a complication from severe burns. What happens in severe burns? There is a reduced plasma volume, and this reduced plasma volume leads to ischemia and cell necrosis, that is sloughing of gastric mucosa. Why it is called curling? The condition was first described in 1823 and named after Thomas Blizzard Curling, who observed 10 such patients in 1842. So the curling ulcer is seen in burns patient. All are true about amoebic liver abscess. Metronidazole is the mainstay of treatment. We all know metronidazole is given in amoebic liver abscess. More common in females? No, it is not correct. It is more common in males. More common in left lobe of liver? It is also not correct. It is more common in right lobe of liver. So the correct option here is D, A and B. So all are true about amoebic liver abscess except A and D, that is A and B. Indication for liver transplantation: biliary atresia, sclerosing cholangitis, cirrhosis, C. Hepatitis A. Now, this liver transplantation is a very important question. Liver transplantation is indicated for those children and adults who, in the absence of contraindications, suffer from severe, irreversible liver disease for which alternative medical or surgical treatment have been exhausted or are unavailable. Most common indication for liver transplantation in children is biliary atresia. In adults, chronic hepatitis C and alcoholic liver disease are most common indication for liver transplantation. So the correct option here is C. Hepatitis A. Liver transplantation is done in biliary atresia, sclerosing cholangitis, and cirrhosis. It is not done in hepatitis A. Care sign is seen in splenic rupture. Is pain over left shoulder. Pain over left shoulder. The correct option here is A. Pain over left shoulder. Splenic rupture, the pain may be referred to tip of left shoulder. This is known as Kehr sign. It occurs due to irritation of the under surface of diaphragm, and this irritation occurs due to blood, and the pain is referred to shoulder through the fibers of phrenic nerve C4 and C5. Kehr sign can be elicited by bimanual compression of the left upper quadrant after the patient has been in Trendelenburg position for about 10 minutes prior to the maneuver. Breast conservation surgery not indicated in A. Large pendular breast, B. SLE, C. Diffuse microcalcification. Correct answer here is D. All. Mondor disease is A. Thrombophlebitis of superficial veins of breast, B. Carcinoma of breast, C. Premalignant condition of breast, D. Filariasis of breast. So correct answer here is A. Thrombophlebitis of superficial veins of breast. Mondor's disease is thrombophlebitis of superficial veins of anterior chest wall and breast. Although it has also been seen in the arm, frequently involved veins are lateral thoracic vein, thoracoepigastric vein, and superficial epigastric vein. Etiology is unknown, also known as string phlebitis or Mondor's phlebitis, is tender cord-like structure. Women may present with acute pain in lateral aspect of breast and anterior chest wall. So it is A. Thrombophlebitis of superficial veins of breast. Lateral aberrant thyroid refers to. Lateral aberrant thyroid refers to. Lateral aberrant thyroid is a misnomer and always refers to presence of metastatic thyroid carcinoma, papillary thyroid carcinoma, that is in cervical lymph node. It does not indicate the presence of ectopic thyroid tissue. So it is a metastatic focus in the lymph node. So correct answer here is B. Most common site of CA esophagus is this CA esophagus is a very important topic. The most common site of CA esophagus is A, middle one third. Correct option here is A, middle one third. Now, the most common type of CA esophagus is the squamous cell carcinoma. 95%. 95%. Distribution of squamous cell carcinoma is upper one third, 10%, middle one third, 60%, and lower one third, 30%. So the most common site of CA esophagus is middle one third. Corkscrew esophagus. Corkscrew esophagus is seen in which of the following conditions? A. Carcinoma esophagus, B. Scleroderma, C. Achalasia cardia, D. Diffuse esophageal spasm. Radiological appearance of diffuse esophageal spasm is known as curling esophagus. It is also known as corkscrew esophagus or pseudodiverticulosis. Diffuse esophageal spasm is a motor disorder of esophagus. It is characterized by repetitive, simultaneous, non-peristaltic contractions. Repetitive, simultaneous, non-peristaltic contraction. The symptoms are substernal chest pain and or dysphagia. Dysphagia. It is diagnosed by manometry. It is also known as nutcracker esophagus, also known as super squeezer esophagus, characterized by extremely high amplitude peristaltic contraction. So the correct answer here is A, D, diffuse esophageal spasm. The most common type of tracheoesophageal fistula. It is very important. It can be asked in pediatrics also. Tracheoesophageal fistula. Esophageal atresia with distal tracheoesophageal fistula. Tracheoesophageal fistula. We can call it as F. is classified into 5 types based on the presence of esophageal atresia and location of fistula. Type A, esophageal atresia without TEF. There is no gas in abdomen. It is second most common. Type B, there is proximal TEF. There is no gas in abdomen. Type C, there is proximal esophageal atresia with distal TEF. Proximal esophageal atresia with distal TEF. Gas is present in abdomen. It is the most common. That is proximal esophageal atresia with distal TEF. So the correct answer here is C. Type D is both proximal and distal fistula are present. It is least common. Then type E is isolated TEF. Isolated TEF. The best investigative modality for gallbladder stones is best investigative modality for gallstone is A. Oral cholecystogram, B. Percutaneous transhepatic cholangiography, C. Ultrasound, D. Intravenous cholangiography. Ultrasonography is the investigation of choice for detection of gallstone and obstructive jaundice. USG shows echogenic focus with posterior acoustic shadowing. The most specific sign of a contracted stone-filled gallbladder is a hypoechoic wall superficial to curvilinear echo from the stone. Wall echo shadow, double arc shadow sign. Investigation of choice for diagnosis of gallstone is acute cholecystitis, acute acalculous cholecystitis, chronic cholecystitis is ultrasound. So the correct option here is C, ultrasound. Strawberry gallbladder is it is the most important, often repeated MCQ in all the PG entrance examinations, including the INICET. It is D, cholestrosis. Strawberry gallbladder is seen in cholestrosis. Now, what is cholestrosis? Cholestrosis is a chronic inflammatory condition of gallbladder with cholesterol deposits. The types are type 1 aggregation of cholesterol crystals in mucosa or submucosa. It is known as cholestrosis or strawberry gallbladder. Lipoid contents are present in large foamy cells that have phagocytosed the cholesterol. Here, cystic duct is normal. Disease occurs only in gallbladder. It is a pre-malignant condition. Then type 2 is cholesterol-laden polypoid projection in the mucosa, also known as cholesterol polyposis or gallbladder polyp. Then type 3 is granulomatous thickening and hyperplasia of gallbladder. It is known as cholecystitis glandularis proliferans. Then diverticular formation in the wall of gallbladder, diverticulosis of gallbladder, and gallbladder with fistula. Correct option here is D. VIPoma is associated with which syndrome? A. Zollinger-Ellison syndrome, B. Werner-Morrison syndrome, C. Carcinoid syndrome, D. Cushing syndrome. The correct answer here is B. Werner-Morrison syndrome. Werner-Morrison syndrome. VIPomas are endocrine tumors that secrete excessive amounts of vasoactive intestinal polypeptide (VIP). Excessive VIP causes a distinct syndrome characterized by large volume diarrhea. Large volume diarrhea is there. Hypokalemia is there, and dehydration is there. Diarrhea is there means dehydration will be there. Hypokalemia is there. This syndrome is known as Werner-Morrison syndrome. It is also called pancreatic cholera and WDHA syndrome for watery diarrhea, hypokalemia, and achlorohydria. The principal symptoms are large volume diarrhea, severe enough to cause hypokalemia and dehydration, and hypochlorhydria and flushing in adults. 80 to 90% of VIPomas are pancreatic in location, with the rest due to VIP secreting pheochromocytome. So the correct answer here is B, Werner-Morrison syndrome. All are resected in Whipple's operation. This Whipple's operation is very important topic. Now, what is Whipple's operation? Let us see what is Whipple's operation. What do you cut in Whipple's operation? Whipple's operation is pancreaticoduodenectomy. It is most commonly performed operation for carcinoma head of pancreas. It includes resection of distal stomach, that is duodenum, gallbladder, proximal jejunum, CBD, regional lymphatics, and head of pancreas. Restoration of gastrointestinal continuity requires pancreaticojejunostomy, choledochojejunostomy, and gastrojejunostomy. So the correct answer here is neck of pancreas. The tendency of colonic carcinoma metastasis is best assessed by A. Size of tumor, B. Carcinoembryonic antigenic level, C. Depth of penetration of bowel wall, proportion of bowel circumference involved. Regional lymph node involvement is the most common form of spread of colorectal carcinoma and usually precedes distant metastasis or development of carcinomatosis. So the correct option here is C. Depth of penetration of bowel wall. Commonest cause of intussusception is hypertrophy of submucous pairs patches. So the correct option here is C. Hypertrophy of submucous pairs patches. So we will meet again in the evening at 9:30 p.m. with another subject. You can WhatsApp me directly on 948-365-2020 or you can click the link in the description box. Thanks for patience. Thanks a lot. God bless you with grand success.